So I think about the challenging in relapsed children, we are moving towards more targeted treatment. So try to divide these relapsed children in subgroups, and for every group try to find the best treatment for them. Like there are KMT2A rearranged patients that are very difficult to treat, so probably we need to integrate with menin inhibitors to try to treat them in the best way, try to find the best way to use CAR T treatment, which is also very effective, but still probably we need to find the right moment, right population to use it in the best effective way. And about frontline is to find the right combination to use these immunotherapies in the best way, because of course they are very promising and we know a lot about relapsed children, but we know few about their use in frontline. If we reduce chemotherapy and we use immunotherapy instead, we don't know yet if we will get the same results. So our challenge is to reduce chemotherapy, so not to add immunotherapy, but to use immunotherapy instead of chemotherapy. But this is what we need to, the question we need to answer in the coming years.